I'm going to jump to Joe Biden's response to some of this stuff because he says,
Yeah.
hey, it's actually he says it in the first paragraph here. I agree with this administration's stated goals. It's not a
Yeah.
left-right issue. It's just a
Nope.
he states this, but the promise of electronic medical records has not materialized for one major region. Medical record companies and health providers have implemented systems that are not interoperable. So we know that already. It's interesting to have this become that elevated. And he goes on to say, we now have we have now had nearly a decade to examine the consequences of how electronic health record systems have been deployed. The industry has had ample opportunity to voluntarily address the issues of interoperability and putting data in patients' hands, and they have not done so. Now it is time for do something about the data silos they have created to improve health and extended lives. Now, is he proposing something different than some of these announcements? Or is he envisioning more of a government hand in this to sort of force EHR providers' hands? I'm curious.
Well, yeah, no, let me disclose, I'm on the Biden Cancer Advisory Committee. So I'm on Team Biden. So just to be clear in disclosure for my bias, what he's really saying is here's some specific steps that are entirely consistent with the policy statements made by Seema and Jared. And he just went a step further to say, here are the explicit government actions that I would recommend. And by the way, I'm fairly confident some of those ideas are likely to be adopted on their own within the Trump administration. So it's not about bigger government, smaller government, it's implementation guidance. And a lot of the feedback people are hearing about the former vice president's remarks is that he was remarkably pragmatic because the suggestions are not massive new bureaucracy expansions, but just tweaks. Instead of a 30-day requirement to give me a copy of my data, make it 24 hours. Not unreasonable in today's digital environment. Directing the NCI, the National Cancer Institute, to kind of build a research data trust and a commons so that you can facilitate the sharing from consumers to researchers, not unreasonable. And then the one that I'm most excited about, he notes that the Medicare Innovation Center, which was created by the Affordable Care Act, has the legal authority to experiment with new models to engage patients for purposes of getting better valued care. So I actually think on all three of those things, they can be achieved with an existing law, maybe not the 24 hours, that may be an interpretation, maybe it's regulation, maybe it's an adjustment to the law, but it's very achievable and pragmatic. And that's, I think, the tone with which he took his piece.